Hello, everyone. My name is Tashiko Sweeney, and I'm here to present to you my educational innovation project for Nursing 597, Part 2 of this practicum class. A little background about the information on my project. I will be delivering an education module to students at a local community college who are first-year students in an associate degree nursing program. And this project is very much needed because students need to be able to apply the concepts that are being taught to them in class, and they need to be able to apply them in the clinical setting when they graduate from school and ultimately become bedside nurses or whatever part of the profession they choose to be a part of. Um, a little bit about what I plan to do with this project. I plan to present to them a uh, project based on prophylaxis modalities used for patients that experience disruption in perfusion and oxygenation as it relates to VTE in the clinical setting. The evidence to support this is what I have seen thus far in being part of the associate degree nursing program here. I was able to compare current testing that students have done to previous years of testing based on the concepts of perfusion and oxygenation. And the way it stands, it seems as though those two concepts are difficult for the students to be able to tie together actually in the clinical setting. They struggle with how the concepts interrelate when it comes to certain conditions that the patient does experience while hospitalized or in the home or whatever the case may be. Um, what I have seen from previous test scores is they seem to score low in the areas of questions that require them to use their critical thinking skills when it comes to the concepts of perfusion and oxygenation, and how do they either apply different modalities to ensure that the patient does not experience disruption as far as those concepts go during hospital stay. My intention for this outcome for this program is to hopefully be able to help them find ways to critically think through situations and apply what they have learned as it relates to the concepts of perfusion and oxygenation, and how do they prevent and or treat when their patient does experience those type of situations in the hospital. The setting for this project plan is going to be in the classroom, where I will present to the students as it stands now, a PowerPoint with voiceover to present the information to them. And after that PowerPoint with voiceover, we will be able to meet in a Zoom meeting, and they will be able to ask questions if there's something in the material that they don't understand, if there's something that needs more clarification, and if they simply are having a difficult time trying to apply the two concepts to the patient situation at hand. We will also be completing a lab simulation. I'm working with my preceptor at this time to try and develop a virtual sim for this project. If I'm unable to develop a virtual sim, what I will do is have the students complete a group case study in groups of 5 to 7 students, and what they will have to do is come up with like a 3 to 5 page paper. And what that will consist of is they will have a patient that is either not experiencing any disruptions in perfusion or oxygenation when they come into the hospital, which could advance into a patient experiencing something since they have been in the hospital, and then that situation could either get better based on the treatments that they use and what they choose to employ, or that situation can worsen to a point of how do I critically think through this situation and do what's best for my patient. Um, the intention for this is for them to be able to take these skills and take this information and apply it at the bedside and know how to treat their patients and how to take care of their patients. So hopefully, um, being that we have to find alternate ways to deliver the information and alternate ways to deliver this project at this point, the options that I've chosen for them will hopefully be able to help them successfully garner those critical thinking skills to be able to think through the patient situations that I will present to them either in the sim lab or via the case study project that they will complete as a group. Thank you guys for listening, and I hope to be able to deliver on this and do a good job. And I look forward to looking into some of you guys' projects as well.